any problem with the sciatic nerve, it joins the spinal cord and it goes into your brain for you to feel the sensation.
Okay,
yes.
So yes, thank you guys.
Yes, so if you check the L5, the L4, L5,
yes.
If you check, there is a branch down there. The sciatic nerve, yes, the sciatic nerve joins down there, and that goes into the leg.
Yes.
So if you see where the illustration of the sciatic nerve is, if you trace it, there is some branches in there which joins the spinal cord, the main central part.
Yes.
Yeah, and mostly it's within the L4 and the L5. So if there is any compression or there is any issue within that lumbar vertebra, then it means that it can cause pains within the sciatic nerve. Yeah, so mostly people feel those pains within the leg, but the pain is not originating from the legs. It's actually from the waist area.
Okay.
Yes, so there could be some issues with the waist area that could be radiating to the legs. Most people with sciatic pain complains that when they sit down and they stand up all of a sudden, there's this sensation, there's this pulling sensation, yes, within that place where they feel the pain. So mostly that is what the sciatic pain is about. It's a pain within either legs. It could be both legs or it could just be one, depending on where the compression is. There could be that pain within the legs.
Okay, so Doc, when you feel a muscle pull in your leg and your leg area, what does it mean for the sciatica then? What's happening? Yeah, so for muscle pull, it's just the muscles that have overstretched. Okay.
Yeah, so and when it overstretches, the pain that you feel is still the sciatic nerve that will send the sensation. But this one is not a compression on the nerve endings.
Okay.
Yeah, so when you check for sciatica, there is a problem with the nerve ending at the spinal cord. So that pain is quite very severe.
Okay.
Yes, so for pains that are linked directly to the spinal cord, the pains can be very severe because that is the main, if it's in electricity, that's the main power that goes into the source. So it makes the pain quite different from other pains. And sometimes you can't pinpoint exactly where the pain is. It's a radiating pain. It's like it moves. So you can't tell that the pain is originating from here. And it can be very painful when people start experiencing some of these things. Yeah.
Okay, so what's the difference between normal pain and sciatica pain? Is sciatica more like intense? Is it recurrent maybe after every 5 minutes? What's the difference?
So for sciatic pain, what makes it so unique is the fact that the location is difficult to predict. You know, for other pains, when there is an injury to a place, you know that this is where the injury is and this is where I'm treating. If you have a wound on your leg, you know that if I treat that wound, the pain will go. If you have a fracture, you know that if I treat that fracture, the pain will go. But for sciatic nerve, because of that complex nature of the spinal cord, those branches there, you wouldn't be able to predict exactly where the pain is. And sometimes it can reoccur. So you can have the pain, it can go down, but with time it can come back depending on how your posture and all those things. Yes, it's one of those things that could affect it. So there are so many things that could actually affect the sciatic nerve. And you know, the waist is like a pivot to the body. Okay. So that is where all the weight on the body lands, the waist. Yes, so all the weight of your body sits on the waist. So if there is any problem with the waist, it means that it could even affect mobility. Your ability to walk could be affected. And you know, mobility is one thing that everybody needs. Yeah, so when it happens like that, it makes it quite difficult. So that is what makes sciatic pain quite painful than other forms of pain.
Okay, so if normal pain is like 20%, what's sciatic pain?
We are going around 80-90%. Yes,
that's pain.
It's very painful. Okay. It's very painful. Yeah.
So how does one get there? What are some of the causes of sciatic pain?
Yes, so the bones within the back, the bones are not just one bone. The bones within the back is just not one bone. Okay. Unlike the bone in the leg, that is just one bone. For the bones at the back, they are small bones that are fused together. Okay. And they are fused together, but they are not scratching each other. There are some discs in there. So if there is one bone, there is a disc there, then another bone comes, then there is a disc, then another bone comes in that area. So those discs within it makes the bones flexible. That is why you are able to bend yourself. Because if the bone was just one bone, you wouldn't be able to bend down. Just like the bone in the leg. The leg bone is just one bone, so it's quite, you can't bend your leg unless there is a junction. That's the knee area. That is where you can bend. But if the bone is just bent to one together, you cannot really bend it. So the bones of the back. Is this it? Yes. So that is an illustration of the sciatic pain. So the blue area is where the sciatic nerve is, and the red area is where mostly you feel the pain. So you could see that it can affect the entire leg. So if you look at where it has been zoomed, there is this yellow thing there, that is the bone, and there is a white thing in between. So that the white thing in between is the disc. Yes, so that white thing in between, let's look at the round area. So the bone is that yellow thing there, and that white thing around there, that's the disc. So that disc prevents the bones from scratching each other. So if you are having a sciatic pain, it could be that white area, that disc, has been herniated. If we say it's herniated, it means that it has shifted, it has moved from where it's supposed to be. So when there is herniated disc and it shifts, it means that there will be compression on the spinal cord, and that could cause the pain that you feel. Also, if there is a degenerative disc means that the disc is there all right, but then it has worn off. So with age, with pressure on the discs and all that, it can wear off. So age is one of the factors.
And then pressure, what sort of pressure?
Depending on the job that you do. If you have a job that demands that, let's say you sit in a certain position or you stand in a certain position for a very long time, it could put pressure on the discs or the vertebral discs. And
does walking a lot?
Walking, for the spinal cord, it shouldn't be in one position for a very long time. Yes, so if you are sitting, it's advisable that when you sit for like 2 hours, you need to stretch for about 15 minutes so that the discs, the spine could be aligned. It has that, it should be able to move in that area. So if you sit for a very long time or you stand for a very long time, there is so much pressure on it, and that could cause the discs to degenerate as you are aging. It could cause it to wear off. Even just like the car tire, if you drive for a very long time, you see that the tires sort of worn out. So the same way the discs or the spinal discs could wear out as you are aging. So it's one of the things that could cause the sciatic pain. So most people with sciatic pain are the aged. When you are aging, it's very difficult to get sciatic pain mostly below your 20s. It's not that common because at that time that degenerative thing wouldn't be there. But as you are aging, it means that there will be that wear and tear, and it could cause that sciatic pain.
So at which age do people usually start complaining? At which age does it, if you are prone to it?
Mostly 40s. Mostly 40s upward, because at that time, if you are working, let's say if your work demands that you stand in a certain position or you sit in a certain position, if you started work, let's say around age 30, you've been doing that for like 10 years. So there could be that wear and tear, so it could affect you. And also when you are aging, there is this synovial fluid, there is this fluid around the joints that helps with lubrication and all that. As you are aging, naturally the quantities go down. So as it's going down, then it could also affect the discs, so it can cause it to also wear out. But there are some people who may be older, but because of exercise and other things that they do, their discs are still intact. So we will look at some of those things that could help. Also a trauma, an accident or an injury to the back could affect, it could cause you to have it could cause the disc to shift, or it could even cause the bone within the spine to shift, and that could cause a sciatic pain. If it's affecting the lumbar vertebra, it could cause a sciatic pain. So these are some of the causes of the sciatica.
Does it ever go away? Does it ever go away when treated? Does it ever go away, or it just keeps coming as you age?
Yes, when you treat, it can go, but it's a lifestyle condition. once it comes, it's a lifestyle condition. So when you start experiencing it, there are medications that could cause it to go down. But you need to be intentional about how you sit, how you walk, your posture, even your core, you know. Sometimes...
What's the right sitting posture?
Mostly when you're sitting, you should sit in a 90-degree angle. Yeah, so that is why most of these chairs have this back support. So when you are sitting, you should sit in a way that your back is touching the back support of the chair. Yeah, so when you sit in that 90-degree angle, all the weight wouldn't be on the waist.
Yes.
So the chair will be absorbing some of the weight. You know, gravity. Yes. When you are sitting like that, there is that force of gravity on you. So when you are sitting in a 90-degree angle, some of the gravity will go on the chair. The chair will absorb some of the weight, yes. But if you sit and you turn yourself in a certain way, sometimes, because most of us who work with computer, you know, you can sit in some way, turn yourself this way whilst you are working on the PC and all that. When you do all those things, it causes problems with the waist. Yeah, because that is the central part of the body, and it causes some of these deviation. It causes some of the discs to wear out. Because the more you are moving in that area, there could be some friction in there, causing some wear and tear within that area. Yeah, so mostly sitting in the 90-degree angle will actually help. Yeah. So for some of the symptoms, you know, some people feel pain and they don't know what actually that pain is. Most of the sciatic pain is sharp and burning, and sort of you feel some burning sensations within the waist. Yeah, so, and it's not just at one particular place, it radiates around the waist. You can feel it at the left side, some few minutes you can feel it at the right side, depending on where the compression is. So anywhere you feel the compression is, you could feel those pains around there. Most people also complain about numbness. So as I mentioned earlier, it's the sciatic nerve that gives that sensation to the legs. So if you are always experiencing some numbness within your legs especially, it could be that there is some compression on your sciatic nerve, and that causes that numbness. You know, there are some people, when they sit for a very long time, they feel so numb, what we call the anansi. They feel that numbness in their legs. If there is that compression and there is not enough blood flow to the legs, then it means that it could cause that problems within the legs.
Okay, is it always when you feel that numbness, or when it reoccurs, it goes and comes?
Yeah, when it goes and comes, and it's mostly associated with pain. So for numbness in itself, it could just be poor circulation. So if you are sitting in a way that occludes the blood vessels, it means that blood wouldn't flow to your legs and you feel that numbness. But when that numbness is associated with pain, then it means that it's actually affecting the nerve. This time it's not just the blood vessels. The blood vessels and the nerves, they move almost the same. But then when only the blood vessel is affected, you could feel that numbness. But when it affects the nerves, then it means that there is that compression on your spine, your vertebral column, which could cause that pain that you're experiencing.
Right, Doc, how about when you bend to pick something, probably lace your shoe or something, and you get up and there's the sharp pain, and it keeps recurring? Does it mean you're heading towards sciatic pain?
It could be. Even with the bending, there is a way that we go about it. And we are all guilty about it. Sometimes when your pen falls down, you bend over to pick it, but the best way is to squat and pick it up. Yes, the best way is to squat. But even most ladies also bend down in that. So the more you are bending and getting up, it could cause some problems within, especially if you are lifting a heavy object. When you bend that way and lift it, that heavy thing that you are lifting could cause some problems within your waist area. Yeah. So if you bend down to pick it, that's the ideal way to lift up things from the floor. Yeah. So that is one thing that we can do to help with the sciatic pain. Yeah.
Okay. So Doc, let's talk treatment options that are available. The self-diagnosis.
Yeah. So when you are experiencing any of those things, you need to check to know whether it's actually a sciatic pain, because as I mentioned, some other pains could mimic that of the sciatic pain. Even some people with numbness sometimes come and they feel, because they've heard of sciatica, they feel it's just sciatica. But if you are actually diagnosed of sciatica, you know that it's different from other forms of pain. There is an x-ray that we can do to check the vertebral column to make sure that there is no herniated disc. The disc is not pressing on any of the nerves there. Yeah, so we can do an X-ray, but with the X-ray you need to get a good place to do the X-ray, or a good X-ray. That is where Medmosis comes in. So if there is any pains within the waist, you come to Medmosis. We will do a digital X-ray for you. That will let us know. When the image was being shown earlier, you said they should zoom it. Yes. So imagine if an X-ray is taken and it's not clear enough, you wouldn't know where the compression is, so you wouldn't be able to make the right diagnosis. So people are going through pains, they've done X-rays, but they are not seeing anything. But if you get a good X-ray, it will be able to show you exactly where the pain is and how you'll be able, and getting a good diagnosis comes with the management, because if we find out which muscle or which nerve is being affected, then we can direct you on what to do, what exercise to do to be able to relieve it. Exercise is the best way. Even with the medical conditions, even with the medical treatment, when you're given medications and all that, you still need to be exercising. There are certain forms of exercise that we advise people with sciatica to do. So one of them is what we call the cobra stretch. Okay. Yes, so for the cobra stretch, you lie down on your abdomen. Yeah, and you stretch. You know how cobra mostly the snake cobra, you know, they like snakes. I see a picture of it. I'm going. So you lie down with your head up there. Okay. Yeah, so in that way there will be some relief within your waist area. Yeah, so the cobra stretch, you can do it morning and evening. It can help to relieve the pain of the sciatica. And also there are certain exercises like the jogging, the brisk walkings, that could also help to relieve the pain. Yeah, but for medication, some people take epidural injections. Yes, so that's it. That's some of the exercises. Yeah, so we have the pelvic tilt. Yeah, that one, you lie down this way. So when you lie on your back with your legs in that position, it could relieve some of the pain. And the cat and camel position, yes. Okay. So you lie down. You know, camels mostly have an elevated back. So you elevate your back, and the cat has their back is a bit inward. Low. So you elevate it and you take it inward. Yeah, so in and out in that way. If you are doing like that, you are actually moving the spine, the vertebral column. So there's that exercise. And the hamstring stretch. Yeah, so you lie down in that way, you stretch to touch your toes. Yeah, so in that way it sort of relieve the pain that you are experiencing. So some of these exercises can help. Yeah. Okay. And people, there are some other people that the pain is so much that they have to take an epidural injection, as I mentioned earlier. Okay. You know, for epidural injection, there is an injection that is given at the back to let you feel less pain within the pelvic area. That's what's administered during childbirth? Yes, it's a similar one. So to relieve the pain of the nerve. As I mentioned earlier, the sciatic pain starts from the waist area and the pelvic floor muscles and all that. When there is any compression there, you feel those pains there. So when people take that injection, they feel relief, but you cannot be taking it all the time. These physical exercises that we mentioned could be a lifestyle thing for you to help. And also garlic actually help. Garlic, Medmosis garlic capsule is one of the things that can actually help to relieve some of these pains. It helps with the nerve endings. So when the nerve endings are affected, when there is that compression there, it causes the nerve. You know, nerves is like electrical impulses. So if there is any movement within it, it could actually affect that. So Medmosis garlic capsules is one of the things that can actually help to prevent some of these sciatic pains. Yeah, so if you're having any form of neurological pain, you can rely on Medmosis garlic capsules and it can help you. So some of these things can help to relieve the sciatic pain. Yeah. Thank you so much, Doc Prince Osei, for doing this with us. Doc Prince Osei is with Medmosis. They own our Tuesday mornings, and this Tuesday we've been talking about sciatica pain. All you need to know is on our Facebook if you go back to the conversation. But also, my take is 15 minutes exercise a day will keep the pain away. Thank you for staying with us. Next up is a conversation we are celebrating here because one of our own, Theophilus Sampa, Monday to Monday, this man is in the newsroom. Sunday to Sunday, he's in the newsroom. Theophilus Sampa
is a SWAG award winner, sports journalist. If you're having a conversation with King Kaf, it's coming up now.